Now we scanning the scrotum. Here we see the right testis, which is normal in size but shows mildly increased echogenicity. Here we see the epididymis, which also shows heterogeneous texture or mildly increased echogenicity but normal in size. And this is spermatic cord, which also shows heterogeneous texture. Now we will scan the internal flow of the testis. When the testis is normal, the internal flow is minimal, but here we see the flow is mildly increased. This is left testis, which shows normal texture, and here we see free fluid in the left scrotal sac. This is epididymis, which shows normal texture and normal in size. This is spermatic cord, which is increased in size and shows increased echogenicity. On color Doppler, we see minimal flow present. Now, how we will write report?